Hello everyone, how's it going? Low back pain is one of the most common reasons for physician visits in the United States. Have you ever wondered if a chiropractor could help? Well, if that sounds interesting to you, then keep watching. Sometimes people wonder if chiropractic treatment is effective. Well, today we're going to discuss some of the benefits, risks, and affordability of going for chiropractic care. Toward the end of the video, I'm going to share with you my personal experience with going to a chiropractor. Now, chiropractic care is known for the use of manual manipulation. This is when a trained person applies controlled force to the spinal joint. The training involves at least 3 years of college, focusing on biology or basic sciences, and then they have to train at an accredited chiropractic college for a minimum of 4 years. In addition to that, many chiropractic programs incorporate an entire year of PhD level advanced nutrition training. Now, experts disagree about the effectiveness of chiropractic treatments. Some prefer to refer their patients to physical therapy, and of course they recommend standard care, which would be a balance of rest, stretching and exercise, pain relievers, and time. Now, even though the studies that have been done have limitations when it comes to proving the effectiveness of chiropractic treatments, many people will attest to the positive results they've received from these adjustments. So what are some of these benefits? Well, having the body in proper alignment actually helps the body to be able to heal itself. So when someone is dealing with an injury or an accident, they'll actually heal faster if they have support from a chiropractor. By gently realigning the joints, it can decrease pain, increase range of motion, can reduce inflammation, help with headaches, with back pain, neck pain, arthritis, and joint pain. The chiropractor can treat musculoskeletal pain anywhere in the body. That's a hard word to say. Including the head, the jaws, shoulders, elbows, wrists, hips, and pelvis, knees, and ankles. A big plus is that in some cases, it can help reduce the need for prescription drugs and possibly even surgery. So that's a lot of pros. Well, are there any cons? Well, before we talk about that, I'd like to remind you to please like and subscribe if you're enjoying today's information. Also, just as a reminder to open up the description box below, you'll find some links that'll take you to where you can read more information on this topic. There'll also be some product suggestions. And if you had some experience with chiropractic care, perhaps you'd like to share your story in the comments below. So what are some of the risks or the negatives? Well, serious complications are rare, but a patient could suffer from a herniated disc, pinched nerves, or a certain type of stroke after a neck adjustment. But as I mentioned before, that's very rare. According to the Mayo Clinic, you should not go to the chiropractor if you have severe osteoporosis, numbness, tingling, or loss of strength in an arm or leg, cancer in the spine, if you have increased risk of stroke, or if you have an issue with how the bone in the upper neck is formed. That would be another reason not to go. But that being said, when you go for your first chiropractic visit, the chiropractor is definitely going to go over your medical history and possibly send you for some imaging. So they may send you for an X-ray, CAT scan, or an MRI. They'll want to make sure that you're definitely a good candidate and that the treatment will be safe for you. Now, some people worry about if it's going to be painful to get adjusted, but it really isn't that painful. It may sound painful, but when you hear the popping sounds, that's actually just the sound of gases like oxygen, nitrogen, and carbon dioxide being released from the joints. Kind of similar to when people crack their knuckles. But for the most part, there's really very little to no pain involved. Now, it is possible that you may be a little bit sore after an adjustment. You may even get a headache or feel tired. Some people actually get immediate relief, but when it comes to others, it may take some time. Depending on what your issue is, it could actually take several visits to help resolve your complaint, which leads me to another con. It could prove to be quite expensive. The good news is that it is becoming more common for insurance to cover these visits, or at least some of the costs. Even people who have Medicare Part B, sometimes they will cover 80% of adjustments after you've met your deductible. However, they may not cover as many as many visits and as many adjustments as your chiropractor may recommend, and they wouldn't necessarily cover other treatments besides spinal manipulation, such as massage therapy, your x-rays, acupuncture, things like that may wind up being self-pay. Now, one of the reasons insurance companies may be covering chiropractic care is because in 2017, the American College of Physicians updated their guidelines for treatment of low back pain to include spinal manipulation. And this is because they've seen so much of the benefits and the low side effects. Also, sometimes chiropractic adjustments could prevent the need of a costly surgery, which is something insurance companies would be thankful for. Now, chiropractic treatment is actually the most common alternative treatment in the United States, and the most common age range are those who are age 45 to 64. Well, how about my experience? When I was only 13 years old, I was lifting some very heavy wood and I twisted wrong, and I suffered a lot of pain actually for a few years. And then when I was about 16 or 17, I actually finally started going to a chiropractor, and it actually helped me tremendously. I was really nervous to go at first, but it really wasn't that bad. The adjustment was pretty easy. When I went regularly, it really helped me a lot. Unfortunately, I've only gone off and on over the years because of the expense and just because I was busy or whatever. But a couple years ago, the pain in my back started becoming so chronic that I asked my primary care doctor if I could get some x-rays. So she ordered some, and it showed that I had mild disc degenerative disease, spondylosis. It's also called osteoarthritis of the spine. So I did a little research, and it said that it comes with age, normal wear and tear, but some people are more at risk if they've had an injury or a trauma. But when it said mild degeneration, I was thinking there's nothing mild at all about this pain. But to be fair, I only got an x-ray. I didn't get an MRI, which would show more. But anyway, a friend of mine had recommended that I go to her chiropractor. She actually took my insurance, and the one I had been going to previously didn't take insurance, so it was always self-pay. So I thought maybe if I could keep the cost down, I would be more apt to go. So I went very often for a while until I was feeling better. I was actually really impressed. It even helped my headaches. I had some pretty bad migraines the last few years, but it also helped my low back pain. Something else that was very helpful was that she recommended ice, moist heat, stretches, TENS unit, which is the transcutaneous electrical nerve stimulation. And I actually read recently that can block or change your perception of pain. So I thought that was pretty interesting. But now I just go every 3 or 4 weeks, trying to maintain the alignment. But one of the concerns I had when I first went was, would I need to undress? And somebody else asked me that question recently, and they don't require that where I'm going now, and I've been to 3 chiropractors, and they never required that. I did a quick Google search, and it doesn't seem like that's something that's generally required at chiropractors. But it is good to wear loose-fitting clothes when you go for your adjustment. Now, low back pain is a leading cause of disability worldwide. With the opioid crisis going on, it's nice to have a natural option to help us deal with back pain. It seems to be that there's a definite link between the alignment of the spine and the function of the body, so you may want to give chiropractic care a try. The most common reasons people go for an adjustment are low back pain, neck pain, and headaches. So if you suffer from any of these, you might actually be pleasantly surprised at how much a chiropractor can help you. Well, I hope you've enjoyed today's information, and I hope to see you in the next video where we'll discuss another way we can improve our health.